So much, sir. Thank you so much for your kind introduction. And I'm very thankful to Dr. Banshi Sabu and the whole organizing team of Diabetes India, Dr. Bharat Sabu, for inviting me here and giving me this opportunity to share my views with you. Now, you've already heard about certain aspects of diabetes self-management, about insulin initiation, insulin inertia from my previous speakers. So I'm sure all of you understand the importance of counseling in diabetes patients. So I'm going to address the topic of counseling not from the perspective of a psychologist or a clinical psychologist. I'm going to address this topic from the perspective of a doctor who meets a diabetic patient, let's say for the first time, and how do you go on ahead from here. This is, I think, very important. The first meeting with the diabetic patient is very important. I'm going to to share my experience, how we do it in our center, and how we have found it to be very effective. So what is counseling process? The counseling process actually is a talking therapy. The way we talk to the patient, the words that we choose, they have profound impact on the patient, on patient's further management, the effectiveness of the therapy that you are prescribing, even the pharmacological therapy. So the words you speak to a patient are actually the healing words. They are very important. So you have to make the right choice of the words, knowingly what you're talking to the patient, how you're talking to the patient, what is important for the patient. So basically, this is the counseling process. What is the importance of counseling? Now, we all know that lifestyle modification, changes that the patient makes in their behavior, have profound impact. What do you think is the maximum HbA1c reduction just by lifestyle modification? Does anyone have any idea? What could be the maximum? 2.5. So 2.5 is the HbA1c that you can't achieve with the newer drugs. You can't achieve that with gliptins, with gliflozins. You can achieve that only with insulin. So just lifestyle modification can give you results as much as insulin. So this is the importance of counseling, because lifestyle modification, actually, what is that? That is behavior change. That is the change in behavior of a person. Now, the patients that usually come to you and to me, they're old patients. They already lived a major part of their life. They're even with younger diabetics, it is 35 years. So majority of them are 50 years or older. They already have their set life patterns. They already have families. They have kids. They have children. They have good lives. Why should they change? They don't want to change. Actually, they don't need to change, but if not for diabetes and its complications. So you must make them understand that why they should change. Now, this is the behavior change that you wish to bring about in your patients who come to you with diabetes. Why? Because you want them to live free of complications. You want them to live a healthy, a good, and long life. So people must know what they have to do. So this is what you do in your counseling process. You must tell them that this is what you have to do, and they must understand why they have to do it, because they are not going to change if they don't know why they should be doing it. Now, this is the first step, the primary step in treatment of diabetes. These are the recommendations of American Diabetes Association, DSMEs, as Dr. Khan mentioned in his talk, and RSSD also mentions this as the primary step in treatment of any diabetic patients. Now, there are many psychological methods. I'm not going to talk about them, like motivational interviewing, cognitive behavior therapy, shared decision making, health coaching, goal setting. We are doctors and I would focus on our conversations with our patients. So now we talk, whenever we talk about treatment of diabetes, we are actually managing diabetes. We are not treating diabetes. This is one thing we have to remember. So this basically consists of these three pillars: understanding diabetes and modifying your behavior, and then executing these thoughts, and then controlling with monitoring of blood sugar or other parameters. Now, I would like to share my experience how we do it in our center. To every patient that comes to me, we show this video. This is actually a PowerPoint presentation. I've made it into a video. Now, this has no sound with it. When the patient comes, depending upon the education level of the patient, from his or her background, I tell the patient about food, about carbohydrate, how that is converted in your stomach to glucose. What is glucose? The glucose is an energy source. It comes into the blood vessel, travels all over the body. Then it goes into something which is called, we call it pancreas, and pancreas produces insulin. So this is all very simple. Any patient with any education level can understand. So if educated, I can talk in English. If uneducated, I can speak about in Hindi. So we have shown this insulin as a key. It comes out of the pancreas. It fits in the cells, open doors, and glucose moves in from the blood to the cell. So the person actually understands what's the problem. Then I tell the patient that, this key is not working or it is not there. So if the key is not there, you have to take it from outside. Or if it is not working, you have to take medicines or do something about it. So the patient is already ready. The patient is already primed. Now, here comes certain motivational elements. Now, why should the patient change? The patient should change because the patient should understand what is going to happen to him or her if the patient doesn't do this or that. So these are the complications that patient is going to face: heart attack, stroke, blindness, problem with kidneys. So I'll just move it a little bit further for the sake of time. And let me see. Okay. So in this video or in this presentation, I also have, okay. I'm sorry, I think I've moved ahead. So I also have some pictures where I show the patients what they should eat in general, what they can have, the 0-calorie foods and sugar. There are some pictures, but it's going to take time. It's almost a 3-minute video. So patient has an idea, patient understands exercise, patient understands insulin, patient understands oral therapies. It is all there in this video. I'll just skip it so that now, why should the patient change himself or herself? For this, we have these positive and negative motivational elements. So why do we wear usually helmets in India? Not because we're going to have an accident, most of the people, and it's going to save their head, but because if they don't wear a helmet or a seat belt, they'll get a fine. So this is how patient easily understands that what is the importance of motivation, wearing or not wearing a helmet. What we do is in our practice, we use a diabetes management score. So this diabetes management score is composed of 3 different elements. One is diet, adherence to diet, adherence to exercise, and adherence to medication. So we record them from 0 to 5. So we have an idea. In each visit, we can see the previous scores. As you can see here, these are the previous scores. And you can see how the patient progresses or regresses, or degresses on the scores of diet or diabetes or diet or exercise. So we can actually work on them. We have seen from our analysis of these scores, which I have already presented earlier, that these scores have a very, very strong correlation to the glycemic outcomes like HbA1c, sugar. And I'll just skip these. And here we can see the importance of change in diabetes in the score of, let's say, diet. If the diet score increases, the HbA1c decreases. Similarly, if the exercise score increases, the HbA1c decreases. So we can see the profound impact. We can choose what we need to work on, because most of the patients would be taking medications regularly, but they may not be doing exercise, or they may not be adhering to the diet. But how do you know that? Because you simply won't remember. You know the previous HbA1c levels because it is written somewhere. So that's what we do with the patient's behavior. We note it down numerically so that we can later on follow up on that and work on those particular angles. Now, this is the trans-theoretical model of behavior change. I won't go into the details because time is almost up. The essentials of counseling are: you should put goals to the patient. This should be your HbA1c. This should be your diet. These many chapatis. This much of walking, 45 minutes walking, or 2 rounds or 3 rounds. They should be very specific, and you should consider them as per the patient. The patient should be able to do them, and the patient should be able to assess whether they have done it or not, and preferably they should be time bound, that the patient should be able to show you in the next visit that this is what I have done. You should always be very specific with the patient, not just general ideas. Give a very specific advice. 15 minute chalo, khane ke baad chalo. Build on previous conversations and always be non-judgmental with the patient. The patient has the right to choose what the patient chooses. You're only helping the patient and you must listen to the patient. So these are the key takeaways. Thank you so much.